Hello and welcome. I'm Dr. Adam Dorsey, a psychologist in Silicon Valley, and I am the host of Super Psyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. Super Psyched is your tool to get more of what you want in your life and less of what you don't. Have you ever wondered what it's like to be a physician during these unprecedented times? How about a key hospital administrator? How do they cope with the fears of patients, their families, their colleagues, and themselves? Fortunately for us, we can learn from a man who is both a physician and a key hospital administrator, as Dr. Brian McBeth has generously offered his time. I have the pleasure of knowing Brian well. He is a friend and someone with whom I have taught a continuing medical education course, and he constantly impresses me for being one of the kindest and most thoughtful people I have ever known. Brian completed his undergraduate studies at Stanford University and earned his MD at University of Michigan, followed by a residency at U of M in emergency medicine, where he served as chief resident. He received his degree as a certified physician executive in 2018, and he has served on faculty at the University of Minnesota and at UC San Francisco. Brian has been practicing at O'Connor Hospital in San Jose, California since 2006, where he now serves as physician executive and physician. Brian is married to a wonderful woman, Dr. Jessie McBeth, who is an orthopedic surgeon and with whom he has 3 children. So join Brian and me as we do a deep dive into the psychology of being a medical worker in the midst of COVID-19. Dr. Brian McBeth, who I will refer to as Brian, welcome to Super Psyched.
Thank you. It's really a pleasure and an honor to join you, Adam. I've enjoyed the couple episodes I've listened to so far, and a great admirer of your work. So thank you for this time.
Oh, it's so nice that the respect is so mutual and the admiration. I've as I mentioned in my intro of you, I think very highly of you, both as a professional and as a person, and so grateful for you to take time. I know you're having some really long days at the hospital, so your time is especially valuable right now. You somehow seemingly effortlessly are able to churn out, 16-hour days, and I don't know how you do it. But I did want to just kind of kick it off by asking this question. Brian, I imagine running a hospital during this unprecedented event has been hugely challenging, and I was wondering if you could just describe some of the stressors surrounding running a hospital during COVID-19.
Absolutely, and thank you again. I mean, I must say that we are blessed with an incredible staff at the hospital. I mean, I'm one of a 3 public hospital system here in Santa Clara County, and we have wonderful management, executive management. We have wonderful healthcare workers and providers. We have a wonderful, team really throughout our hospital and the other hospitals as well. So it's a blessing and an honor to be able to be one member of that team. There is stress. There is a lot of stress around COVID. Obviously, as we're seeing sick patients, as we're challenged with changing dynamic and uncertainty. And I think, one of the challenges around COVID has been the uncertainty and at times debate and disagreement, controversy around best practice, best treatment, approach with, different infection prevention strategies. And the fact that really things are changing week to week, if not day to day, right? So we're all trying to stay up to date on the current recommendations from the CDC and the Public Health Department. But there is, there's the stress of seeing the patients and the uncertainty that they are facing when they're coming in sick and in need of medical care. And there's the uncertainty that we're all kind of figuring this out on the fly, whether it's the researchers, whether it's the clinicians at the bedside, whether it's the administrators trying to figure out best strategies around PPE or infection prevention, visitor policies, how to deploy resources, all those different things. But, again, I have to acknowledge, in the background, the Public Health Department, what the work of Sarah Cody, the health officer for the county, and her kind of perspective engagement and her foresight in some of the work she's done, the shelter in place order, and also a thank you to the public for following those directives, which aren't always easy to follow, but that her work, their work, the public health department's work, and all the public's engagement in those recommendations has really saved innumerable lives. So we've done well locally, and we have all of those people to thank.
It's interesting, as I listen to you, one of the things I appreciate about you personally is that you are a planner. You show up on time. You have an incredible prefrontal cortex. You have that executive ability to just look ahead and plan like a really great strategist. And at the same time, as an emergency physician, you seem nimble enough to be able to just kind of shift on a dime. And I'm thinking that these two skill sets have been absolutely necessary in this time of great ambiguity to be able to plan and yet shift immediately.
Oh, thank you. That's really nice of you to say, and a generous compliment. I mean, I think, not speaking about me specifically, but emergency medicine as a field really does have an ability to, not knowing what's going to come in any given day, to be nimble and facile in terms of, trying to roll with the punches, trying to figure things out in a way that has been highlighted in the COVID crisis. But, not only the ED, but, all the hospital resources where people have come together trying to figure out, how to handle this. I think it's been a source of stress, but at the same time, it's nice to see, because it's really what we're all about in a way. I mean, you talk to healthcare workers in general, and somebody who's dedicated their life to providing care for other people, you're in the same shoes. Your professional life has been dedicated to helping other people. And, that perspective when there's a crisis, and this certainly has been a crisis of pandemic proportions, and we're excited to be able to contribute and be there for that need. And, at the same time, the challenges are, while stressful, are ones that we are embracing both professionally and as an opportunity. One other point about, just hospitals, I think we've seen like so much of medical care has moved into the outpatient setting. You have surgical centers, some of them very profitable, and outpatient options for so much of care, which is appropriate a lot of the time. But a crisis like this really emphasizes, again, the importance of hospitals and being able to provide the emergency care, being able to provide the critical care services in the ICUs, and those things you can't do in an outpatient setting when people get sick enough. And this COVID-19 is really a reminder of the importance of that infrastructure locally and nationally to supporting good health.
So, you function both as an executive, as a physician during this time. So you wear two different hats. And I'm wondering what it's been like to go in knowing that you could be exposed to the virus multiple times. What's that like for you?
Well, I think, again, we have a dedicated staff that's put a lot of thought into the infection prevention side, the proper PPE. At times I've heard it, said in different media outlets that there's worry about healthcare workers not having adequate PPE to protect themselves to do their jobs. And that may be true in certain areas. I wouldn't want to speak broadly, but for us locally, we've had the resources we've needed. We've had the PPE and the personal protection, which has been hugely important, obviously. And some of that, frankly, is because of donations too. I mean, there's been such a public outpouring of support from the community, from different, very creative sources at times, making donations and donating money and actual manufactured PPE supplies to us that have been critical. So, when I walk into a room, I have the confidence that I have the infection prevention team that is thought through, and we've vetted these strategies on the appropriate equipment to be wearing to protect ourselves. We are fastidious when it comes to, the simple kind of basics of hand hygiene and practices that keep people safe and healthy. So when I see a patient, I have confidence, even though the patient is undifferentiated. They're coming in with symptoms and we don't know, for instance, if they have this infection or not. We approach in such a way that puts provider and patient safety first. And that's really our focus from the whole institution.
If you look up the definition of courage in the dictionary, it always includes the presence of fear, that there is no such thing as courage without it. And I'm wondering, do you experience fear in the midst of all of this?
Yeah, I think, fear and anxiety are so connected, the uncertainty of where things are going. So, there is a lot of uncertainty, and there is definitely anxiety, whether it is, in the individual caregivers and their day-to-day work with patients, or on a more systemic level, like, what are our strategies 3 months from now, 6 months from now? Where is the curve going to go? Are we going to see second and third waves? Is it going to be like the influenza pandemic of the early 20th century? And so these things are tough to predict. And I don't use the term fear. It doesn't really describe what I feel, but the uncertainty and the need for kind of foresight and thoughtful planning is certainly very important. And, I think, we've done work on wellness, burnout. You yourself we've collaborated on some really fun kind of productions for healthcare workers on how to mitigate, burnout. But I think a lot of the fear, anxiety, these things come from uncertainty, from overwork, from error, medical error, a topic that's near and dear to my heart. So these things that we can build structures to support caregivers. And it's so many different things. It's having the adequate PPE. It's about education. It's about having adequate staff, making sure they have enough time off, all those kind of resources. And so I don't use the term fear, but I certainly acknowledge all of those kind of issues that come up day to day.
I'm wondering also, in spite of the fact that you don't experience fear, I imagine many of your colleagues who, in spite of the fact that they are kind of healthcare heroes, they experience fear, I imagine. And I'm wondering, how do you act as a good colleague or someone who is in your position as an executive to kind of help mitigate the inflammation that they may be experiencing in the form of fear?
Yeah, I think you're right. And some of it is around education, certainly. So if somebody is fearful or uncertain about best practice, or maybe getting information from unreliable sources, that can contribute. And so, education is a huge component. And so making sure that, even in the setting of uncertainty, that we're using the best data that we have, that we are, sharing that on a regular basis. Those things have been hugely important. So, for our staff, for our nurses, for our physicians, we have regular kind of updates around COVID-19. So whether they be online town forums for Q&A, whether they're engagements on the department or the hospital levels, these things we schedule on a regular basis. However, there's another side to it too, because, when somebody's coming with anxiety, job related, you don't know what's going on in the background. You don't know the personal side. And there may be, maybe they're a single parent at home and worried about their own safety because they're the ones responsible for the child. Or maybe they have an elderly family member at home that they know is high risk should they come down with this COVID-19 infection. So there's all sorts of personal dynamics that you're not privy to. And so to that end, I think it's important as a leader to try to engage that, not necessarily that you're going to get into a deep kind of psychological evaluation of their circumstances, but certainly be sensitive and listen and ask the simple question, what is it that you're really worried about? Let's try to get at that issue and let's try to address that. And oftentimes with kind of simple open-ended questions, they'll open up and you'll be able to address their fears and their anxieties in a productive way.
So anxiety mitigation through listening and properly providing them with education from reliable resources about how they can feel empowered in the face of this. It sounds like it's your number one strategy.
Yeah, I think it's important when you interact with staff. It's frankly a similar strategy that we use at the bedside with patients, right? So somebody may come in to the ED or to a clinic visit, and the chief complaint or the reason on the paper might say they're there for a prescription refill or for this or that complaint. But if you sit back and listen, or if you ask, how can I help you today, and just sit and listen and don't interrupt with your needs, you'll often hear why they're really there, and you're able to address the concern that drives them in, and sometimes avoid doing a lot of unnecessary testing and putting them through going down a path that really doesn't need to be explored.
I love that. And I think these open-ended questions, these ostensibly simple questions like, how can I help, can make a world of difference. Are there any other good questions? I just am a huge fan of questions. I believe that the quality of your questions actually determines the quality of your life, in all seriousness. But what have been some good questions that you've come across that you carry around with you as you check in with someone?
I think, that open-ended, like, how can I help you? So establishing not like why you are here, you can kind of hear the difference in the tone between.
Definitely. It's why are you here is almost puts them on the defense.
Let's get on with it kind of thing.
Right.
So you instead, how can I help you? You establish that you are there to provide help in terms of healthcare, in terms of a service. And then, another great question kind of at the end is there anything else? Is there anything else that's bothering you? Anything else that we can talk about? And all of a sudden, sometimes it opens up, and there's been some research around these points where, and the communication of these healthcare patient interactions. And I think the worry on the provider side is that this will turn into an hour conversation and they'll be late to the next patient, but oftentimes it's not, and it's time well spent, an extra minute or two to really figure out, where they're coming from and make that connection, because, when they leave the office, the follow through, the quote compliance with your therapy recommendations, these things are really related to the relationship that you have and the trust they have in you. And if you're cutting them off and moving on to the next patient without a second thought, then that's going to be limited.
Yeah, there have been so many studies that have shown that the effectiveness of the treatment plan is correlated with the rapport that is developed between doctor and patient. It seems that good medicine starts with good questions.
Absolutely.
And that's just wonderful. Malcolm Gladwell cites in Blink a study that showed that patients are far less likely to take legal action against a physician if rapport is present, and that rapport can be the difference of the doctor having spent just a minute more on average with the patient, just having a quality interaction. And I think that's obviously we're not talking about legal material here, but just I find that statistic salient to our conversation as well. Just so many good things happen with good communication.
Absolutely. I mean, even without, the specter of like a lawsuit, like just looking at medical error and the fact that communication kind of breakdown comes up time and again when you look retrospectively back at what happened, where the safety event occurred, you'll see that, breakdown in communication between patient and physician, or physician and nurse, or nurse and patient. I mean, there are these common themes that run through many of the bad outcomes, even outside of kind of a legal setting. And so there's endless opportunity to improve communication in the hospital.
Yeah, and just it's such a great reminder that this, above all else, is an interaction between two people. And I almost infer from it almost like a Martin Buber like I and thou style. I and thou taking this interchange as being something of a holy interchange, not to just evoke a religious sense, but that the two people interacting is a very important thing to you.
Yeah, no, I think Martin Buber is a great example of a philosopher who really espoused that kind of connectivity, like the connections and the bigger than just the I, the fact that as we are establishing this relationship, as we are looking to connect and really help somebody, that we have to open up and we have to listen, and we really have to be attuned to their needs, and not only the medical needs. Sometimes it gets into the social and into the psychological, and if it's a challenge. There's no doubt there is a tension between these other not unimportant needs for being productive, for taking care of the line of patients who are waiting for care, for the other, the resource limitations. But if we neglect that personal connection, and then we must question why we're here. it gets into empathy, I think, in a lot of ways, right? So, I think you're probably familiar with Jamil Zaki, the Stanford professor's work around empathy, and his The War for Kindness book that came out pretty recently, and some of his research on around healthcare professionals, but other walks of life too, and about how this connectiveness, this empathy, and really listening and being there is something that we can teach and we can develop in our learners and it's really a skill set that we need to be attuned to and focus on with some mindfulness, or else it erodes over time, especially given these other pressures and these other demands on our work lives.
It was interesting to hear you say that. And one of the things that a lot of people are saying is that COVID is almost shining a bright light and exposing cracks in various systems. And I imagine that now, more than ever, empathy is a resource that's needed. And I'm just wondering, can you describe the weather in the hospital, so to speak, in light of COVID? What new insights have you developed, and what's it been like in the hospital, attending to patients, attending to their families around COVID?
Well, I think in a general sense, I would just say that it really has highlighted the empathy that we see in so many different interactions, and certainly in the healthcare worker with the patient. People are attuned to the needs of the patients coming forward. The patients are attuned to the perspective of the healthcare worker too. So almost in a two-way interaction. I've heard, and kind of an appreciation for you really appreciate that you guys are here. It must be tough for you, and we're not soliciting that. This is what we love to do. That's why we're here, right? But even expanding beyond those patient physician or patient nurse interactions, looking at acts of empathy around the hospital, just the generosity of food donations from the community, a perspective of again compliance and following the public health directives, because we know that this will keep other people safe. It's not necessarily that I'm young and healthy, I'm a 20-year-old. If I get it, maybe the odds are pretty good, I'll be okay. But, a lot of people realize it's about a bigger issue. It's about our grandparents. It's about our loved ones. It's about our community. And if we have that perspective, that empathy, that empathic consideration of lives beyond our own, or our own family, or our own community, then we start to see the bigger picture. And I think we've just seen that reflected time and again, both within hospital walls, but in the way the community interacts with the hospitals and our healthcare system. So it's been a joy, and it's really been encouraging. And I think in some sense given us confidence that we can weather a storm, and certainly we'll debate best strategies to weather that storm, and we may debate, the leadership decisions in politics, but at the end of the day, we're all about trying to protect lives and save lives, and it's heartening, I would say.
That's so touching to hear, and I'm hearing this reciprocity that's transpiring between patient and medical professional, that it's really becoming kind of a two-way upload and download.
Yeah, those comments have been repeated in the ED and in the critical care units, and just again, we appreciate, and I've heard it in kind of national discussion forums, just the appreciation coming from patients during this time, patients and families, and it's tough on families too. We have these pretty restrictive visitor policies where they bring somebody who needs care, and then we really most of the time ask them to kind of wait outside, and we communicate with them, and we have technology that helps us out in significant ways. We use FaceTime and other tools to interact and do distance telehealth kind of connections, but we ask families to be separated much more during this crisis than they would be during a regular non-epidemic time, and yet they've been supportive, and they've been, acknowledging in terms of the hospital's needs, the care of other patients, and again, in an empathic way, kind of supporting decision-making that has kept a lot of people safe. So really appreciate all that kind of support from the community in so many different ways.
That's amazing. It sounds like they get it, that this is a different time, and that we are physically distancing ourselves for the sake of a great many people who are vulnerable.
Yeah. Yeah. I think it's well put.
Yeah. Since we're talking about the beauty in the face of something really ugly, that is, objectively ugly, COVID, there's no way to make it pretty. And yet it sounds like you're seeing sides of humanity emerge that are beautiful. And I'm wondering if you could tell us some other stories of some of the beauty that you're seeing in the face of the ugly.
Well, I think a lot of it, in nice ways, has been picked up by the public media. So examples of, private citizens who maybe have a sewing machine and start to put together own masks and donate them to others in the community or to the hospitals. We've had local Boy Scout troops reach out to us and offer to do presentations and acknowledgments. We've had the local law enforcement staff do very public kind of displays of thanking the healthcare workers at all of our public hospitals here in the county. There's been an outpouring of warm donations from all walks of life. I've heard stories of individuals donating a single N95 mask to a caregiver because that's what they had, and it was somebody in the community who felt like this could be a single mask that was better used by somebody in the hospital than they could use. And so that on such a granular level really kind of describes like how people feel a personal connection and a personal responsibility to contribute to this effort. And it's a beautiful thing. And like I said, heartwarming. And if you're working long days in the hospital, like you see those gestures and they're so meaningful. They're so powerful. It gives you all that energy to come back the next day and to really feel like people care and people are behind you.
Well, I'd like to circle back to something you said earlier about one of the top coping strategies, and you cited good information. And I know that there's so much bad information out there, and there are good sources. I'm wondering, what are the good sources for the healthcare workers, and what are the good sources for the consumer that we can really confidently say this is the most up-to-date and good stuff?
Yeah, it's challenging, right? Where our go-to sources are certainly the CDC, the World Health Organization, but even more important are the local public health authorities. So, we're interacting with the public health department, and even for the public, they have a dashboard that's publicly available. So if you're interested in COVID-19, Santa Clara County has done a very nice job in terms of turning out numbers, so you can log in and without any password, just look at things like the hospital census for the county, the number of total cases, current active infections, mortality, all these things. And they've shared that data publicly. So if your listeners are interested, maybe there's a way I can give that website, but that'd
be great for the show notes.
Yeah, we can definitely do that. So those are go-to kind of sources in terms of best practice recommendations. There are professional societies that we look to from the hospital in terms of, being on the front lines. The emergency medicine groups and the critical care groups have been important. In more of a public way, it's challenging because I think there's a lot of data coming from a lot of different people, and even in a kind of a, I guess, back to a physician's way, it's tough to evaluate the data, like in terms of the scientific studies, because a lot of them are being turned out very quickly, and peer review and kind of the vetting of the data typically takes a while as people kind of go through these things. So it's more challenging to really look with a critical eye at some of the stuff coming out to know best practice, and even more so from a public point of view. You get very mixed messages. I think the best thing you can do is kind of trust that the public health authorities have the best interest of the public in mind, that healthcare workers and hospitals are trying their best to follow those recommendations. And we all kind of do our part, and not necessarily buying into any given news story that's coming out. Again, it can be variable, but I guess I'll pause for a minute and just say that we do get information from those public media sources, and sometimes it is helpful to see kind of international perspectives and get some perspective on how challenging it is in other areas, and again, make us grateful for the resources that we have and here locally.
That's great. And I remember at the outset of COVID, somewhere around March 12th, traveling through emails was this hoax that was posing as a Stanford medical blackboard communication, and it was entirely false. And I'm just wondering, how can people find out if something that you're getting from that well-intentioned family member is real or maybe should be disregarded?
Yeah, that's difficult, and I don't know that specific hoax, but I know misinformation certainly is propagated frequently. I guess I would say that if you have access to a primary care provider that you trust, that is a great source as well. I should certainly mention that. And a lot of the PCPs in the community have kind of transitioned by this point to doing telehealth and are amenable to other means of communication, whether it be email, questions, and so forth. So those are great resources. But if something is coming through that seems really contradictory to what the public health department is saying, or turning us in a different direction, no matter if it has like a supposedly reputable university's label on it, then we have to look at that with a critical eye. And when we are debating some of these different changes in policy, what our executive and leadership approach is really to get multiple opinions and try to bring in a consensus before jumping to conclusions. And sometimes that can slow down the response a little bit, but it makes it more, it gives us more confidence that when we are making policy decisions, for example, that this has been through not just one or two sets of eyes, but really through a perspective from multiple different parts of the organization.
Great. There are so many unsung heroes in a hospital setting who are perhaps doing their work when nobody's seeing it being done. The security, the maintenance, and of course the receptionists who are seen. But I'm wondering if you have any stories about them. They're exposing themselves and perhaps not being given the love and respect that perhaps other healthcare workers are. I'm just wondering if you have any stories about them or ways that they can feel like they're part of something because they are part of something really important.
Yeah, I'm glad you brought that up, actually, because again, coming back to the concept of teamwork, as healthcare workers, we could not perform without those people that you're mentioning, the staff, the engineers, the EVS, the environmental service workers, right, that clean and put themselves, at risk for infection as well. And those people don't get all of the frequent accolades. I mean, one thing that's really been nice with a lot of the donations to the hospitals is they do reach those people as well. So like the food donations and so forth are shared with all those workers. And but so I remember one point at the start of the COVID-19 crisis, I met with a group of our EVS workers, our environmental service workers, and talk to them about some of their concerns, because again, they're collecting biohazardous material that they're worried about the risk to themselves and their families. And I think as an organization, it's really critically important to have them involved, to provide opportunities for dialogue so you hear their concerns. And you involve them in the process of decision making, whether it's, how do you distribute your PPE or your infection prevention strategies that acknowledge, their perspective and concerns as well. And if you have an organization that really engages all the departments and all levels of contributors to the healthcare product, then I think you have a greater level of trust. You work toward an organization that's nimble and being able to deal with crisis. And ideally, that's how we see ourselves and hope to continue to be in the future.
Yeah. So Brian, you do a lot. You can put out a 16-hour day. You are a father, you're a son, you're a husband, you're a member of various communities. And I wonder how you do it all. How do you keep yourself from fatiguing out yourself? If I were to hire, for example, a group of documentary filmmakers, I imagine a lot of the things that you would see, you would be maybe even surprised by some of your self-care practices that keep you afloat. But what can you share with the listeners that you do to allow yourself to perform these really hard tasks of a 16-hour day?
Sure. So, and I should make clear, 16-hour days are not the regular day, but they do come up.
They happen periodically.
They do. So I think some of my own personal strategies that I've found very worthwhile. One is exercise, and in my current role, I've had to adjust that a little bit by getting up. I'm not a morning person, frankly, but I've had to make myself get up, 30, 45 minutes earlier to get out and get a run in the early morning hours before going in, because that's the only way I can find to do it. But the exercise component is hugely important for me. The family is critical for all of us. And I feel like during the last couple months, I have to certainly acknowledge the importance of my family to keeping me grounded. And I have a wonderfully bright, supportive and loving wife. And so I'm very blessed in that area, and our kids as well. So those individuals are critically important to me being able to function. Just being out in the fresh air is important. I think you've talked about some of this in your wellness work, and just even getting outside for a few minutes and seeing the sun and taking a quick walk around the block. It can be therapeutic in so many different ways. And then I guess the last one that comes to mind is spirituality in terms of kind of creative approaches. So, many of us engage church or synagogue life and on a regular basis before this all started. And I think, the crisis and the inability to congregate has been a challenge, but people have come up with creative ways to do it. And I still enjoy connecting with my community on a weekly basis. And that's hugely important to me. So, yeah, I mean, I imagine you've probably developed a lot of or sustained your own wellness coping strategies that you've had to be somewhat creative too during these times.
Definitely. And exercise has been really important. I couldn't agree more. Getting that cardio in is a game changer. And I agree with you with regard to connecting with other people who matter within the community. Brian, what would be some just generic but useful tips to the healthcare worker, because they may be listening countrywide with any luck? What might be some best practices be to keeping themselves mentally and physically at their best during this tough time?
Well, I would, go back to some of the things we just said, but certainly maintaining the connection with family, and it can be really trying. I mean, I've heard stories of some separated from families because of choice not to want to expose their family to potential infectious, pathogen, and that has led to at times isolation. So I think, continuing to communicate, continuing to engage your families in whatever way that is allowed, and adequate time off. So not grinding yourself into the ground in terms of really long shifts without breaks, with attention, again, to your own personal health, and acknowledge of the stress and anxiety that we're all dealing with. And so I think it's important to have, somebody you can vet to. And oftentimes it's other healthcare workers. It's, your colleagues, and those those mechanisms are really important as we're kind of struggling through some very long days sometimes, to not neglect those connections, not neglect those friendships, those family connections that are the basis of our own physical, mental, and spiritual health. And that's really the way that we have to kind of structure our long-term continuity and ability to engage in the jobs that we love, right?
I would corroborate that idea of having greater connections with your colleagues. It's a day and night experience. Having their back, or at least their perceived support. One of the things that I do, you may know, I've done it with Facebook, and I'm doing it currently with another company called DigitalOcean, is I foster greater connections between the team members through talking about more real stuff, as these are for the safety and security teams at both companies. And they see some pretty gnarly stuff, and having the ability to just reach out to a colleague is just a really big deal. So yeah, I would affirm that 100% as being probably strategy number one almost.
We have to be able to talk about the challenges we're going through, and I mean, you know this probably better than me as a psychologist, that bottling up or not dealing with the stress and anxiety only comes back to haunt us later in terms of the burnout issues that we've talked about before.
Yeah, I've often thought of it as amassing a debt with interest over time.
Mm-hmm. Yeah, no doubt.
So we're kind of getting toward the end, but I'm wondering if there is anything else that has been useful in the midst of all this that you've learned in light of COVID. What has this most unwelcomed teacher taught you as a healthcare professional?
I would turn it back maybe to the importance of trust on so many different levels. So, again, in the time of uncertainty, how do we trust the organizations that give us the information for best practice? How do we trust the provider in front of us? How do we trust the community to do the right thing and stay home in so much uncertainty? And again, it comes down to a very human connection and the empathy we talked about before, this acknowledgement and truth, I think, that people really do care about each other, and they are not so self-centered that they're willing to neglect the good and the health of others for their own needs. And so I think it's been affirming in terms of that inherent and very kind of basic trust of person to person. And I've seen it just manifest in so many different ways. And I think it's going to be hugely important going forward as we're looking at future cases or the next big thing, the next big challenge in healthcare. And I think that trust, that importance of trust, can drive us to find solutions for some of the very challenging problems in healthcare, even beyond COVID. So, the issue of having universal healthcare or aligning, on a national level, some of our incentives and our needs to support public health and get, underserved patients and cultural groups the equity that they deserve. So again, I am encouraged. I'm optimistic coming through this, and I hope that many others are as well.
I'm going to geek out for a second. How, in your experience, is trust built?
I think it's something that you walk into a room and you take a deep breath and you listen and you try to make that connection. And it's, if you have a relationship with a provider for 20 years, obviously that's built over time.
Sure.
But most of our interactions are not that way, right? And so it comes to your initial approach. It's not the why are you here? It's like walking in and sitting down and taking a deep breath and giving them a chance to say how they need help and being willing to engage that. And in the, in community and other settings, it's really about listening too. It's about not making assumptions about what another person wants of you, but really, giving them the benefit of the doubt and having that willingness to appreciate somebody else's perspective, whatever realm of or walk of life you're looking at.
It sounds like just the outset of the relationship is the formation of the trust, the framing of the relationship as how can I help?
Yeah, I think so. And it's the assumption too, coming to it with a positive assumption that people do want to help, that somebody is going to listen. So giving, again, benefit of the doubt that like people are generally good and they do want to connect and they do want to help. And I've just seen that time and again. I mean, we can come up with examples of where whatever people are misbehaving or not using, the resources or not following the directives that are out, but there's so many more examples that don't come to light, but we see them every day. And if we open our eyes and appreciate that, I think the balance is tipped toward the positive and again, optimism that we can weather this crisis and continue to do the research and continue to come up with therapies that work and trust each other to support the communities and the workers. I think it's all part of one big package.
Yeah, it sounds like trust is kind of the nucleus. It's almost the Chicago O'Hare Airport. Everything passes through trust, and in as much as everything seems to pass through Chicago O'Hare.
Well, I love your aviation kind of analogy because that we've talked about patient safety and designing systems to reduce error, and the healthcare systems as a whole, I think, have a lot to learn from aviation. So there's been a lot of great work done in that area. And we learn from other industries in terms of checklists and those kind of things. So aviation examples are near and dear to my heart.
That's so cool. I remember that actually from our shared presentation. I'm wondering what other industries do you learn from that might be even surprising to the listener that a medical professional would learn from?
So aviation is probably the biggest one, but firefighting. So, so in these settings with medical students where we're teaching about error and systems and leadership and so forth, we use examples like the Tenerife disaster in 1977, where so many people lost their lives with the crash of the two planes in the Canary Islands, and all of those factors that went into that. The communication issues, the language barriers, the hierarchical kind of inability to bring concerns to your superior, and the pilot kind of overriding things, and all those different pressures, the economic pressure. So as a wealth to teach us, there's the Man Gulch fire. So the firefighting episode in 1949, where tragically so many firefighters lost their lives when the foreman actually had a solution that could have saved them, but nobody was listening to him and he couldn't communicate adequately. It's an example that Don Berwick from the IHI uses in his teaching and wrote a book about escape fire. Those are there's opportunity to learn from naval navigation as well, like some of the naval accidents where, again, errors are made kind of repeatedly, military sources as well. So I think medicine has a lot to learn from a lot of different fields, and one idea that we've brought is the being suspicious within medicine, the NIH data. So if it's not invented here, not National Institute of Health, but the NIH not invented here. So take expertise from psychologically is something that I think healthcare workers and medicine could learn a lot from, because so much great work has been done, and we could incorporate that into our cognitive strategies to make decisions at the bedside.
I'm wondering also, I could almost see somebody saying, okay, if I just ask, how can I help? That will be the be all and end all. I think that's the starting point. I imagine that there's almost a way that they must talk to themselves as they ask the question to open themselves up to the answer. Because I imagine if you just utter the words robotically, how can I help, without actually really meaning it, that it could actually go south. I'm wondering, is there kind of a little bit more, almost a mental prepping that one does before engaging in a patient interaction and uttering those words, how can I help?
Yeah, I mean, there's been some research done, a paper that came out in JAMA just a few months ago about strategies in terms of the initial approach. So spending, one of the techniques was spending a minute reviewing the chart as you walk into the room. So you walk in not with a blank slate of knowing nothing, but rather that you can see and you can start the conversation after the how can I help, saying, I see you were here some time ago. I have some knowledge about, where you've been or who you are. The listening techniques, the open-ended questions, these things are hugely important, and dialogue around obstacles. So like, what are the barriers that you're experiencing in your own life right now? So I noticed that you didn't fill the prescription I wrote the last time you were here. Why is that? Was it challenging for you to get a ride to the pharmacy? Was it you couldn't read or understand the English prescription that was given to you? Was it, you don't have the resources to pay for it? And those kind of explorations and listening and being attuned to not only just a disease and then a medicine or a therapy for that disease, but rather trying to understand a whole person. And it's a challenge, but it's really why we're, healthcare givers, right? To help people. And it's the opportunity.
Wonderful. And, I know you're a former college level athlete, and I love sports psychology. I think sports psychology is actually apropos of this conversation in that the way one talks to oneself before the athletic event really actually makes a difference in how they play and how they talk to themselves. I mean, our primary relationship is not with our mom or dad or our spouse even, it's with our thoughts. And I imagine just holding the cognitive thought as looking at the chart, saying something akin to, I hope I can be of help, might actually allow for a priming process in the brain so that when you ask the question, how can I help?
Yeah. I think priming is a great way to describe it, right? Right. You set yourself up for success, and maybe there are techniques that you can nudge yourself in that direction by putting a physical reminder up, like before going in, like, have I done this, or whatever cue that you need to again, take a deep breath, be in the right mindset. So you're not thinking, I'm late, I'm 20 minutes behind, and I'm never going to get through my day, and I'm hungry, and all these other things, but rather you're focused on the person in front of you. That priming, that framing of the whole encounter will set you up for success, and the patient as well.
And I'm also thinking about the other applications of that question, just even asking one's spouse, how can I help? Mm-hmm. I know that when I ask my wife that question, she loves it. And there is a chief medical officer, if I recall, in the TV show New Amsterdam. I forget the name of the character on the show, and that's basically his slogan, how can I help? And he asks that to his colleagues, and he asks that to his patients, and here you are rocking that mindset. Before we go, Brian, what is something that maybe I should have asked but haven't yet asked?
Oh, boy.
And it's okay. I realize I'm putting you on the spot. If there's nothing that comes to mind, that's also a perfectly adequate answer.
I think, so much of our work is about collaboration as well. And I would just say that I've very much enjoyed our collaboration, you and me, over the last few years. It comes back to collaboration between disciplines, our ability to learn from others' work, and really, to pull from Danny Kahneman, who we both admire. I think the idea of an outside view, a perspective beyond our own. So I appreciate like what you bring to the table, what you bring to our friendship all the time, and professionally how you've kind of shared with me your knowledge and expertise, and provided an outside view and a perspective that I've learned from. Medicine as a whole can learn from psychology, can learn from these other disciplines, and we're all the better for it. So thank you.
I love the fact that we have an interdisciplinary relationship in addition to a friendship. And Danny Kahneman, who is a Princeton professor and the recipient of a Nobel Award for Science, for behavioral sciences, he wrote a great book called Thinking Fast and Thinking Slow, which I know you and I both love. His work is just tremendous. So any of you listening out there, just check him out, at least on Wikipedia. You'll fall in love. This is a man who really who really breaks down human behavior in such great ways. My last question, you kind of alluded to it, but I'm going to ask it anyway because I think it's such a, anyway, let's see what you say to this. And I'm wondering how you hope we will have grown after this is behind us. I know a lot of people, I heard an interview between J.J. Abrams and Conan O'Brien, in which they both declared that several weeks after COVID ends, we will simply revert to our former behaviors. And I'm just wondering how you hope things might change in light of COVID.
Well, I would come back again to the optimism that I think we've seen reflected repeatedly, that people do care about each other, that again, maybe from this, there's an opportunity to start broader dialogues around national health care for all, that we can start to address some of the disparity that we see out there. And maybe even outside of healthcare, some of the poverty that we see. I mean, maybe I'm being too Pollyannish in this, but if there's an appreciation that we're all in this together, if there's an appreciation that our fellow human is near and dear to what makes us the I-thou, again, coming back to Buber, that relationship is central to everything that we do and that we live, then maybe we have opportunity to start to tackle these big problems. Maybe then we can get beyond like the industry interests and the challenges of the politics and the economics behind healthcare reform. I'm optimistic, and so that's where I hope it changes. And I think if we have more people kind of with that mindset, we'll get there. I have all the confidence that we will.
Well, you'll be heartened to know that the idea that hope alone is not a strategy is only partially correct, because all strategies must begin with hope, at least according to another researcher with whom I spoke. So I'm with you on that hope.
Yeah, we need to have solid plans and a plan for getting there. But again, a building that has in its foundation, acknowledgement of the ethics of, equity of healthcare, of care about our fellow human being, of sharing of resources. These things will drive us in the right direction. And that's how we build policy. And that's how we get to the practical solution and the answer to these seemingly insurmountable problems, which are not at the end of the day.
Absolutely. I'm with you. If we can get to the moon, come on.
Absolutely.
We can do this. Brian, I can't thank you enough for your time, your expertise, your humanity and kindness. Thank you so much for sharing with my listeners.
It's really been an honor and a pleasure. And thank you for all the work you do and for sharing this. And it's been a pleasure.
Right back at you, man. This is Dr. Adam Dorsey thanking you for listening to Super Psyched. To listen to other great episodes or to get more information about today's episode, please visit me at my website, dradamdorsey.com. That's DradamDorsay.com, and click the Super Psyched podcast link.